We invite Dr. Amal Harsha de Silva to address the gathering at this occasion.
Let me first of all welcome our Honorable Sajid Premadasa, our dearest opposition leader and former Minister of Health. We have been very, very close with us, and would like to welcome you, sir, for this National Healthcare Exhibition. And we are very lucky to have you as our chief guest today. Then also we have Susantha Malavarachi here, who is the chairman of this Poultry Association of Sri Lanka, who is giving the live proteins for the Sri Lankans. Welcome you, Susantha. Then we also have Niran Piris, who has given oxygen for the health sector right through from across the breadth. He has visited all the hospitals. Welcome you, Niran, for the National Healthcare Exhibition. And then all the other distinguished guests who are here for representing the private and public health sectors of Sri Lanka. We are meeting under one roof every year, all the stakeholders keeping the nation's health in this exhibition. Therefore, this exhibition is the meeting place for all the top healthcare providers in Sri Lanka under one roof. Whether it's Ayurveda, whether it's wellness issues, or whether it's healthcare providers, are meeting under one roof. Normally, sir, we don't meet them very often in this manner. We are all busy in our own day-to-day lives. We are caring for people. We are busy in our day-to-day lives. But this is the occasion, the 3 days, we used to meet together and then discuss leisurely as to how we can develop healthcare together. Not only with Sri Lankans, we also have got Indians coming here, about 20 pavilions coming from India, Services Export Council of India, and then also from other countries as well. Singapore is joining us in the National Healthcare Exhibition, and also USA was joining with us in a big way. Therefore, when it comes to country's health, we need all the support from everybody to do a better job. Sri Lanka has done extremely well in health. Average health is very good in the region. But in the meantime, we also have aspired to give high-cost individual interventions. We need to learn from many countries around the world. And that's what we do. We try to talk to each other and then see how we can better what we are doing on a day-to-day basis for the Sri Lankan people. Therefore, we are very lucky to have our opposition leader, who is very close to us and who has been very concerned about the public health in a big way. We see you, sir, discussing things in the parliament which are very relevant on a day-to-day basis for public life. And therefore, we would like to see that country prosper in healthcare in a much bigger way. There is a huge opportunity in Sri Lanka to do more health tourism. Tourism in the country is growing up, and then health tourism also can be a big boom for the country. Now we know there are many who are providing good quality health care in Sri Lanka. Now, when it comes to giving health care to others, we are always lucky that we have many who have the talent to provide health care in a big way. Yeah, we would also like to receive Honorable 𝐒𝐞𝐲𝐬𝐳𝐬, who is MP in the Parliament, and also our dear friend. Come, please. Yes. Yeah. We are extremely lucky to have Honorable 𝐒𝐞𝐲𝐬𝐬 as well at this August exhibition, because I think he has been very close to health from the very beginning. He has helped many lives in Sri Lanka, and then also given a lot of support for the health sector at the critical moments of the need. And therefore, I think we have very important people participating in this particular juncture in healthcare. And I must say further, our opposition leader has been very, very close to our hearts, sir. Not just in words, because basically you have been discussing many things which are relevant for health and which are very, very important at the critical times. I can remember how you discussed the matters during the COVID time. I think if the government at that time took the advice that you gave, we would have a better country today. Because we did certain mistakes at that time, and then ultimately a lot of communities got angry with us for nothing, and then the Middle East got upset. And I think healthcare is very, very touching everybody's lives. When it's healthcare, we don't want to be discriminated. We want fairness. We want the governments to show goodness in healthcare. Therefore, when once you are little discriminated in healthcare, you feel very bad. And I think the present government is very good comparatively. Sir, Honorable 𝐒𝐞𝐽𝐲𝐧𝐢𝐬 sir, he's aware of what's happening at the grassroots level, and I think with everybody's support, I think he should be able to do a good job. Because in healthcare, there is no party politics, sir. There is no party politics when it comes to your health. There is no divisions when it comes to health. You must all work together to improve public health. That's why the private health sector is subsidizing the government health sector today, sir. And this exhibition, we don't charge anything from the public funds. We do cross-subsidization from the private sector to the public sector, and all the associations which are representing here, including Ceylon College of Physicians, are given free stalls without any payment. And that's a beauty when we work together. When we work together, we can do wonders. And I think Honorable 𝐒𝐞𝐲𝐬𝐬 is here. He has a lot of entrepreneurial ideas, and let's see how we can take our health sector to the globe. We have done extremely well in healthcare. We have been managing good health at low cost comparatively. Our life expectancy has doubled during the last 4 decades, and that's due to consecutive governments investing heavily on healthcare. Now, every government has been trying to overcome the other by doing good for the people of this country. And I think, we have been always been very lucky with our health ministers, except for 1 or 2, because they have all done very well for the country. So they have been selfless as far as we are concerned. Therefore, we are very lucky to have successive governments, who is very concerned about public health. There are many governments in the world who doesn't care about people's health. And there are governments who ask, can you afford to have a heart attack? Sri Lanka is not that. We are very concerned about our public. We are concerned about the people. And then we always want to do better for our people. And therefore, sir, it's a very momentous occasion. And we would like to welcome all of you. And also thank you personally for taking time off your busy schedule, especially the opposition leader and Honorable 𝐒𝐞𝐽𝐲𝐬𝐬 and all other distinguished guests for taking time out to the cause of public health in this country. Thank you very much.